Every evening during Ramadan, in apartments across Cairo, a tradition brings millions of Egyptians together, watching one of the many series produced especially for the festive month. During commercial breaks, Faris Ahmed sees the same appeals for donations to charity hospitals.
عشان تقدم العلاج لكل محتاج بأحدث الأجهزة.
Hospitals try to produce as many advertisements as they can during Ramadan because that month has a special meaning for Egyptians. They know it's the time when Egyptians donate the most, whether they're rich, middle class, or poor.
With a single click or by scanning a QR code, millions of Egyptians are encouraged to give. For the 9 charity hospitals that run advertising campaigns, the competition is fierce. Some invest considerable sums to produce highly poignant advertising campaigns. About an hour outside of Cairo stands a brand new building, the first charity hospital in Africa entirely dedicated to treating burn patients. It opened last year thanks to donations. Naim Moamen is a surgeon at the hospital. He is examining a child who suffered burns on 35% of his body after a pot of boiling water fell on him.
A small burn of 25%, 35% burn of the total body surface area, the chance of survival is really very low, 50% chances. But with the care that we provide here, we managed to improve this to up to 60 and 70%. That's why any serious case in another hospital, even this university hospital, they send it to us here.
All treatments here are completely free, and most of the cutting-edge medical equipment has been imported from Europe. To cover these enormous costs, Ramadan donations are crucial. At the hospital entrance, an entire room is even dedicated to welcoming donors.
Mustafa is the most important person in this hospital. He is our donation manager.
During the 2 sacred months leading up to Ramadan, and especially during Ramadan itself, donations double.
Actually, we managed to raise more money to open an extra 150 beds, so we full capacity, 200 beds.
Charity hospitals refuse to disclose exact figures, but some collect up to 80% of their annual budget during Ramadan. Yet behind the gleaming facade of these modern clinics lies the harsh reality of Egypt's public healthcare system. Public hospitals are accessible to everyone, but face shortages of qualified staff and medical equipment. Mohammed Hassan, a cardiologist, is a member of an association advocating for the right to healthcare for all. According to him, only a tiny minority of Egyptians have access to high-quality free care, while the state continues to largely neglect public healthcare.
The expenditure on health is 1.2% of GDP.
With a healthcare budget 10 times lower than the global average, Egypt's charity hospitals struggle to keep up with the scale of need.
Or maximum 1% of the total beds of Egypt are charity hospitals. They do something, of course, but they give the bad impression of the whole situation is good because they give something to a sector, whether in cancer, in maternal health, in burns, but they don't affect much the bad condition of health, which is dependent mainly in all and each country in the world on the governmental expenditure.
But for underprivileged Egyptians, charity hospitals remain the only chance to access free, high-quality care. In this working-class neighborhood of northern Cairo, a clinic founded in 2019 specializes in pediatrics. Leila Taha has traveled 200 kilometers to have her son treated.
Can I examine you?
He needs another operation after a previous procedure at a public hospital failed.
Hopefully we'll operate on you here at this hospital. He was operated on in another public hospital for a stomach hernia, but the surgery was unsuccessful. Now, in addition to the hernia, he has a narrowing of the esophagus.
For his mother, this hospital is her last hope, so that one day her son could be able to eat normally. without having to turn to an expensive private clinic.
For years, I tried many hospitals, so many hospitals, because he has had trouble swallowing since birth. It's extremely expensive because we saw many private doctors and each one said something different. Some asked for 3,000 or 4,000 euros. It's not just financially exhausting. They also give different diagnoses every time. Some talked about a transplant, others said, we don't know. We'll open him up and see. Here, I trust the doctors.
In 2024, the government launched a program to privatise healthcare facilities. It has raised fears that access to healthcare could become even more difficult.